Thank you to all of our leaders of our wonderful association. You are the heart of our mission, and I am forever grateful for your dedication to this work. This past few years have brought drastic changes and challenges to all of us. Our usual approaches to issues in our community is not enough. We need to think differently about how to address issues around violence in our schools and our communities, and the trauma that is experienced by our youth as a result. We all know how important it is for us to listen to our children. We also need tools to support them through any troubles they may face. This is why we wanted to host a symposium on this topic. Our conversation is guided by our trauma-informed care position statement, which we adopted in March 2017, and it outlines our commitment to this critical work. We also come to this work with key national partners advocating alongside us on Capitol Hill, such as the Child Trauma and ACE Policy Working Group, which consists of over 30 national organizations and led by a national nonprofit, Futures Without Violence. Over the next hour, we'll hear from congressional leaders and national experts on the impact of violence on our nation's youth, especially girls of color. We will also discuss the increased rates of childhood trauma that youth in America are experiencing every day. Our goal is to empower you as you are in the front lines and on the front lines working with our school communities. We want to make sure that they are more aware of the personal and societal trauma students are experiencing on a daily basis and how to use our collective voice to combat the negative effects on violence and trauma. To begin, we will hear from Senator Shelley Moore Capito and Dick Durbin, who are the Republican and Democrat leads in the U.S. Senate for the Rise for Trauma Act. This is federal legislation that would strengthen school and community efforts to support children and families who have experienced or may be exposed to trauma. Let's give Senator Capito and Durbin a warm welcome.
Hello, everyone. This is Senator Shelley Moore Capito from the great state of West Virginia. Thank you all for being here today. It is so important to have active parental participation in our education system. The partnership between families and schools is critical to making sure children are best served. Without that relationship, children suffer the most. Unfortunately, many children fall victim to a trauma when little to no help is available for them. That is why in the Senate, several of my colleagues and I recently introduced the Rise from Trauma Act. This bill would help children coming out of terrible situations move forward successfully. By aiming to increase resources for our communities and taking steps to expand our trauma-informed workforce, we are helping to prevent victims of trauma from becoming victims of other afflictions like substance abuse and violence. Passing this bill would mean more of our young people would have a better chance of getting ahead. I firmly believe this bill can change lives for the better. Our children are the future, and we should be working to ensure that they have every opportunity to get ahead, whether it's at school, at home, or in their future careers. Once again, thank you for all of your hard work, and I'm looking forward to seeing what you accomplish next.
Hi, I'm Senator Dick Durbin. Let me welcome you to the National PTA Youth Risk Prevention Symposium. We're here today to discuss ways to protect our kids from trauma, which is the root of so much pain within our neighborhoods and families. According to the Center for Disease Control, 1 in 5 teens have witnessed acts of violence in their community. Gun violence has devastated families and neighborhoods, and it's now the leading cause of death of children in the United States. The emotional scars from gun violence affect entire communities, the victims, their families, those who witnessed it, those who see an empty desk in their classroom. But there is hope. With the right care and support, children who experience trauma can heal. That's why Senator Capito, Republican of West Virginia, and I introduced the Rise from Trauma Act, a bipartisan bill that will help break the cycle of violence. Our bill also would increase resources to build the trauma-informed care workforce, teachers, school-based mental health professionals, school leaders, to help kids who've experienced trauma. In particular, our bill would provide $50 million a year to bring more clinicians into schools through the National Health Service Corps. By fixing our broken system, we will take more than mental health support services in schools. will bring them hope. Raising a child takes a village, so we need engagement from parents, families, and communities to provide safe, nurturing, inclusive environments. I want to thank you all for coming together for this important cause. I look forward to working with you to help heal the wounds of trauma.
Thank you so much, Senator Capito and Durbin, for your commitment to this critical issue and to the safety, well-being, and success of our nation's children. We look forward to working with you to heal the wounds of trauma. Now, I'd like to welcome our panelists, and get ready, guys, they are amazing. Dr. Christopher Jones, the U.S. Public Health Service Director for the National Center for Injury Prevention and Control at the CDC. Dr. Ross Greene, Advisory Council Member for the Attachment and Trauma Network. Abigail Hurst, Director of Trauma-Informed Programs for Everytown for Gun Safety. And Dr. Stephanie J. Hall, President and CEO of Girls, Inc. To start off, each of you could share your background, if you don't mind, and perspectives on the topic of our discussion today. Dr. Jones, I'm going to begin with you. And before I start with you and get into this discussion, I learned some fun facts about our leaders. And so, Dr. Jones, I'm going to show you guys a fun fact about Dr. Jones. He's a tap dancer. He loves to tap dance. His original major in college was musical theater. His favorite musical is Oklahoma. Thank you for joining us today, Dr. Jones. Can you define trauma and help us understand the most common types of trauma experienced by children and how they affect their development and well-being?
Well, first, I just want to say thanks so much, and actually really appreciate the opportunity to be here today to talk about CDC's work in this space. Appreciate you recognizing my tap dancing skills. I somehow found my way into science and public health, pharmacist by training, also have advanced training in health policy, and have been working in the area of mental health, substance use, and trauma for many, many years. And I think we are at such a critical point in time for our young people and the next generation in particular, by raising up the visibility of these issues and thinking about how we can collectively work together to address them. At CDC in the Injury Center, we focus on preventing all forms of violence, including adverse childhood experiences, as well as the prevention of suicide, substance use and drug overdose, and unintentional injuries. So my goal here today is to talk about some of the latest data to help people understand sort of where we are, provide some definition of trauma and how we think about that at CDC, and then share some thoughts about how we can work together to address these challenges. And before I get to your question specifically about defining trauma, might want to turn it back to see if others also want to introduce themselves on the panel.
Okay, thank you.
Hello, thank you for the opportunity also to be here today, Anna, and thank you. I'm grateful to the PTA for creating pathways for us to really unite as a community in support of the critical trauma healing work that we need to do for young people. I was a former school administrator, and now as president and CEO of Girls, Inc., which is a youth-based community organization, I'm very familiar with the power that exists when we bring our expertise and our resources to the table to help young people overcome challenges and really provide opportunities for them to express themselves and to succeed. Girls, Inc. is an organization that really believes that girls have something to say, and it's our job as adults to listen. So this is a great connection to make with the PTA. On the topic of mental health and trauma, unfortunately, they have had a lot to say, and we have learned a great deal. At Girls, Inc., we work with over 100,000 girls, ages K through 12. Particularly, we work with girls from low-income communities and communities of color, and they are letting us know every day that their mental well-being is at risk. They're seeing instability and lack of safety in the school settings that they're in. They're seeing women's rights taken away. They're witnessing economic insecurity. They see environmental threats. These girls are constantly faced with anxiety, And the stressors, of course, are amplified for girls who are in a financial situation that is precarious. So we are listening. We are simultaneously equipping our girls with the knowledge and the skills and the experiences to affect positive change in their own lives, to take some of the control back. We provide them with safe spaces to express themselves. We give them a chance to interact with their peers and with great adults. And that gives them the opportunity to become leaders. They can change the world, and they can see that trauma does not have to define them. We have evidence-based programming, and we also work with them on college and career opportunities, networking with great women in leadership, breaking barriers across industries. They have done everything from meet with the first ladies to build a rocket, to advocate on the steps of the Capitol for issues that matter to them. And this is a holistic approach to girl development. This is something that we see that helps girls see that the possibilities are endless. So I'll just end by saying that, when you bring Girls Inc. or other youth services organizations into the space to work with the schools in the communities, we really can help young people, especially girls, take the power back and see that they have that inherent power to become the great adults that they are destined to be. So thank you.
It is such a pleasure to be with all of you today. And thank you so much to Anna and the National PTA for hosting this forum. So I'm Abigail Hurst, and I'm a social worker. In most of my career, I've worked with survivors of different forms of trauma, including survivors of intimate partner violence, sexual assault. And for the last 7 years, I've worked with survivors of gun violence through the Everytown Survivor Network. We are a national program that offers trauma-informed programming for survivors of gun violence to connect with other survivors through peer support programs, as well as programs that create a platform for survivors to take action to end gun violence. And that's through legislative change and raising awareness if they choose to. Over the years, as I work with survivors of gun violence, I've seen the power of survivors to create incredible systemic change, at the same time that I've also witnessed the grief and the trauma and the pain of gun violence. We know gun violence is a crisis that's unique to the United States. Our nation's gun homicide rate is 26 times that of other high-income countries. Guns are the leading cause of death among children and teens. And I'm going to say that again. In the United States of America, guns are the leading cause of death for children and teens. And research also shows that youth firearm suicide has reached its highest level in more than 20 years. And we know that each incident of gun violence sends a reverberation of trauma with short-term and long-term effects. So there are no simple solutions to the epidemic that is this complex, but there are clear steps that we can take at the local and the state and the national level to both disrupt cycles of violence that we know oftentimes have trauma and grief at its core, and provide survivors with the support that they need to be able to heal. And that's why I'm really honored to be speaking with all of you today on such an important topic.
And I'm Dr. Ross Greene. I'm a child psychologist, probably best known for a lot of the books that I wrote, The Explosive Child, Lost at School, Lost and Found, Raising Human Beings, and for the model of care that I originated that's called Collaborative and Proactive Solutions, which is often referred to as trauma-informed, probably because it doesn't involve the use of power, does involve collaboration, and gives kids voice and agency, all good things. But I'm also founding director of the nonprofit Lives in the Balance, which is a free hub of resources on the CPS model, but also does a lot of advocacy work for federal and state bills that are aimed at getting rid of punitive, exclusionary, disciplinary practices. We're really proud of the work we've done with the CPS model in some pretty tough settings. Prisons, urban schools. We don't shy away from the places where it's hardest to get it done. And we do get it done. Just as an example, in the prison system in Maine, They used to have a recidivism rate of 85%. It's now 15%. We are known for helping schools get rid of the use of restraint and seclusion and suspension. All things that the research in very compelling ways tells us is damaging to kids who least need those things to be done to them. So that's who I am, and I am very honored to be invited to be part of this panel.
Thank you all for sharing. You can see the passion coming from your heart. Let's get into this discussion. And we'll start again with you, Dr. Jones. And thank you for introducing everybody, letting them introduce themselves. Thank you so much. I'm going to ask you the question again. Can you define trauma and help us understand the most common types of trauma experienced by children and how they affect their development and well-being?
Yeah, and I think this is so important because oftentimes we might be using different terms to talk about childhood trauma. And so we may have missed opportunities for shared and collective work together because people are using different terms or defining things in different ways. At CDC, we refer to childhood traumatic experiences as adverse childhood experiences, or ACEs, and this builds on research work that CDC and others did a couple of decades ago to really understand how does what happens in childhood influence somebody's life and their life course. And so we define ACEs as potentially traumatic events that happen in childhood that can have profound impacts throughout the life course. ACEs can take many forms, including experiencing violence, abuse, or neglect, such as physical or emotional abuse or sexual abuse, witnessing violence in the home or community, having a family member attempt or die by suicide. But also included in how we conceptualize ACEs are aspects of a child's environment that can undermine their sense of safety, stability, or bonding. So growing up in a household with substance use problems, mental health challenges, instability due to parental separation or household members being incarcerated. But we know that there are also other experiences that were not in the traditionally defined ACEs that can have similar physiologic effects on individuals. And we know that these traumatic experiences in childhood and the teenage years can really increase someone's risk for future exposure to violence, perpetration of violence, mental health challenges, substance use, and chronic health problems. In fact, ACEs are associated with at least 5 of the leading causes of death in the US. Overall, we see pretty consistently in the research that about 2/3 of adults in the US have experienced at least one ACE in their lifetime. So this is not something that's happening on the margins of society, but it is something that is prevalent in communities across the country. We also see that about 1 in 6 adults have experienced 4 or more ACEs. And that's important because we do see this cumulative effect that as people are exposed to additional ACEs, their risk for health-related challenges increases. Some of the most common ACEs that we see in our epidemiological research are exposures to emotional abuse or neglect, physical abuse, witnessing violence in the home or in the community, exposure to parental substance use or mental health challenges, and parental separation or divorce. Again, there are changing dynamics here. We've obviously seen a substantial increase in firearm-related violence, firearm homicide, firearm activity in communities, and increases in community violence in recent years. So that is also something that's very prevalent in people's lives that can substantially impact their sense of safety and stability in their life. I think it's also important to point out that ACEs are not evenly distributed across the population. We see females, communities of color, disadvantaged communities, LGBTQ individuals often having higher rates and prevalence of ACEs and exposure to ACEs and multiple ACEs as well. And so sometimes we're often asked, how do these early experiences in childhood have an impact throughout the life course? And we try to break it down into really showing that those early years, when somebody is in the first few years of life through the age of 5, that's really where the building blocks for what's going to come are being made. And you think about brain development, how we process emotions, how we process rewards, the cognitive development. And at the end of the day, decades of research now very clearly show that ACEs, exposure to ACEs and other adverse environments in the community can create toxic stress. And it's that toxic stress that can have a profound impact on emotional regulation, cognitive development, those basic building blocks that can lead to increases in health risk behaviors and ultimately translates into chronic disease or other health risks later in life if there are not steps taken to mitigate that toxic stress. And I think that's the last point I want to make is that first, ACEs can be prevented. There are public health solutions that can be brought to bear to address trauma and adversity in childhood. But the other point is that because you are exposed to trauma does not predict where your life course will go. And I think that's really important. ACEs are associated with increased risk, but we also know humans are resilient. We know that there are other factors in a child's life that even if their home is chaotic, other people showing up consistently being there for them, telling them that they are loved and important can also have profound protective effects in reducing the potential risk that might come with ACEs. And so I think just it's so important to underscore that this is not a predetermined trajectory for someone's life, but it is important to raise awareness that these early events can have substantial implications if we don't work together to address them in the first place or mitigate them when people have already been exposed to ACEs.
Wow, what a way to start this conversation. Thank you, Dr. Jones. It's preventable if we can get to it at the beginning. Thank you for sharing all of those facts with us. Dr. Greene, you're next. But before I ask you your question, I want to share some fun facts about you. He lives in the woods in Maine, and he loves being on the water. And when I say woods, I'm including porcupines. Dr. Greene, you developed the collaborative and proactive solutions model that provides a trauma-informed approach to working with children and youth who are navigating social, emotional, and behavioral challenges. Given your background in scientific research in this area, how can families and caregivers identify the signs of child trauma and related stress, and what steps can they take to provide support and effective intervention?
Well, there are so many signs. I could take my entire 2 or 3 minutes by going through them, but among the most common are things like anxiety and depression and withdrawal and aggression and oppositional behavior and attachment issues and symptoms of PTSD, such as intrusive thoughts of the event. Now, here's what's interesting. I've been working with kids with concerning behaviors for a very, very long time, some with trauma histories and some without. Whether a child has a trauma history or not, I view their concerning behavior the same way. It's a frustration response. It's a stress response, which is very different than viewing the behavior as attention-seeking, manipulative, coercive, unmotivated, limit testing, which are still some of the very unfortunate ways in which kids who have concerning behaviors are often characterized. So I think the important thing here is to see the behavior through the correct lenses. The child is struggling. That's what the behavior is communicating. And it's always hard to establish causal factors with great precision. But one of the things we want to be most sensitive to in the case of a kid with concerning behaviors is the potential that trauma is underlying their concerning behaviors. Now, in terms of support and effective intervention, I am the first to tell people that I am biased. The CPS model, as I said earlier, is frequently referred to as trauma-informed, probably because, as I said earlier, it contains many of the ingredients that one would look for in trauma-informed care. It gives kids voice. It gives kids agency. It's not about power. It's about collaboration. And most importantly, perhaps, it doesn't involve interventions that cause harm. I listen very closely to the voices of adults, many of them diagnosed with autism, who have experienced interventions that for a long time, many people were thinking of as being fairly benign. Suspension is not a benign intervention. Corporal punishment is not a benign intervention. Restraint and seclusion are not benign interventions. So I spend most of my time trying to help educators and staff in therapeutic facilities and parents view these behaviors through the right lenses and recognize that the last thing that they want to do is re-traumatize the already traumatized. And many very popular interventions, in my view, are re-traumatizing the already traumatized. And they're very popular interventions. Let me give you two cases in point, and then I'll be quiet. In listening to voices of the adult autism community, I have heard them tell me that planned ignoring, one of the hallmark interventions of the behavioral approach that I was trained in, they experienced as traumatizing. And you know what? It makes sense. How could being ignored, sometimes known as withdrawing reinforcement, withdrawing attention, how could that be experienced otherwise? And my mentality is, if somebody tells you that an intervention caused them harm, even if it didn't cause you harm, we should listen to them. And if there's another way to accomplish the same thing that you were trying to accomplish with planned ignoring without causing harm, we should do it. The other example I frequently hear about is, and as you can tell, I'm in the trenches here, sticker charts. Many adults will now tell you that that seemingly benign intervention caused them to be identified at a very early age as the kid who didn't get the sticker. Now, if not getting the sticker did them any good, maybe they'd have a different view, but not only did they not get the sticker, and not only were they identified that way at a very early age, sticker loss, we might call it, doesn't solve any of the problems that are causing their concerning behavior in the first place. There are interventions we need to stay away from so that we don't traumatize the already traumatized. And there are interventions we need to move toward that are evidence-based and far more productive.
Wow. My goodness. Thank you, Dr. Greene, and for sharing the science of what we could look for. I wouldn't have never known. You just gave a golden nugget when you talked about the sticker results. Thank you for sharing that and how it impacts our children. Okay, so now we're coming to Abigail Hurst. I want to share some fun facts about Abigail. She is training for her very first marathon this November. And when she was 12, she was in a cover band, and she loves the Spice Girls. Abigail, I want to say thank you for the work that you're doing with gun violence. Being a gun violence survivor, I know firsthand how important it is to understand how this can affect your life. So when we think about traumatic events and experiences that shapes the child's ability to adapt or rebound from adversity, we want to consider the daily threat of gun violence that continues to terrorize and plague our communities. How does gun violence affect children differently from adults?
Thank you, Anna, for the question. And Anna, I just want to thank you for sharing your own personal connection to gun violence. I also want to recognize that these topics can be difficult to share, and they can also be difficult to hear. So folks in the audience, if you need to step away at any time, please take care of yourself and do whatever you need to tend to any trauma that could be coming up for you. So to answer your question, when it comes to the trauma of gun violence, so much is at stake, including our children's futures. So every year, nearly 4,000 children and teens between the ages of 0 and 19 are shot and killed, and another 15,000 are shot and wounded, and approximately 3 million witness acts of gun violence. And the trauma of exposure to gun violence overlaid with other forms of trauma that we already have heard about affects children in every avenue of their lives. So we know that these symptoms are physical, they're emotional, and they're social, as we heard Dr. Jones and Dr. Greene already speak to earlier. The response to this exposure can impact a child's ability to learn and hinder their school performance. It can also leave them angry or withdrawn. And other symptoms can include anxiety and sleep problems. We know that trauma can lower their career aspirations and prevent them from reaching their full potential. The prevalence and the threat of school shootings in particular, it's created a generation of young Americans who are growing up with the constant fear of being shot and killed in a place that they should feel safe. And for students who have experienced other incidents of gun violence in their houses or in their communities, the trauma and the symptoms, they're really compounded. So this is taking a significant emotional and psychological toll. And although less than 1% of gun violence occurs at schools in the United States, and those are mass shootings, 75% of youth ages 15 to 21 are citing mass shootings as a primary source of stress in their lives. We also know, with talking to bereaved parents whose children have been taken by gun violence, they speak about how each incident of gun violence that they see on the news or that they hear about on social media or they see in their own neighborhood or in their communities, those bereaved parents think to themselves, that is someone's child. And because of a core identity that they hold, their identity as a parent, they may experience a trauma response. And this could include feeling unsafe to go about their daily lives, difficulty concentrating or focusing on tasks, emotional outbursts, or even numbing or avoidance. So even without a personal connection to gun violence, when we think about incidents of school shootings or shootings in public spaces, parents are often afraid to send their children to school, and I hear about this a lot. They struggle with how to talk to their children about what happened after an incident of gun violence, and whether that's on the news, on social media, as I mentioned before, or if it's an incident of gun violence that happened in their own community. And that collective trauma of being exposed to incidents of gun violence again and again, it is shaping the behaviors and the actions of children and parents. So many times I've had parents tell me about the mornings when they hug their child just a little bit tighter before they send that child off to school. And the reality is that we do not have to live like this in our country, and our children do not have to die like this in our country.
Thank you, Abby. Wow. That just touched my heart. You're absolutely right. Just thinking about hugging your baby before you send them off to school, right? Tugs at everyone's heart. So thank you for sharing that. Dr. Hull, before I ask you a question, I want to share a fun fact about you. She collects vintage Vespa scooters and has many of them in her garage. Dr. Hull, how can child welfare systems, nonprofit organizations, and youth-centered programs be made more trauma-informed, and what improvements can be made to ensure the readiness and capacity to provide trauma-informed care?
Just as teachers, I think, really know that you have to tailor your teaching approach to the learner that you have in front of you, I think we need to be ready to meet teachers and parents and caregivers and youth serving organizations really where they are, especially with a topic as complex as identifying and responding to trauma. We know that different communities and different cultures still think very differently about the existence of trauma and about the best way of dealing with trauma. And given what we've just heard from all the other panelists about the high exposure really that everybody is facing to trauma, but especially females, people of color, people in low-income communities, we can't really forget that so many of the parents, the teachers, and the other adults working with young people may still have their own trauma, and possibly that is unmanaged, untreated trauma that they're contending with. So one thing I think we need to think about is offering these folks a chance to get their own oxygen masks on firmly, before trying to help others. We know that it is exhausting and demoralizing for the leaders in our communities to see so many young people struggle and not be able to make enough of a difference. And we know we need to pool our resources and to do more to make training accessible and affordable. And that's hard in a world that still seems wary of people who are different. Too often we are choosing polarization over pitching in communities. So I think my answer is really that there won't be one methodology. There won't be one way we can do this, unless the answer is something like we need culturally responsive, differentiated, just-in-time resources. We need them to be written in hundreds of languages. We need them to be videos for people who don't read well in any language. We need subtitles. If we wait for it to be perfect, we won't really have any answer. But I do think we need to start somewhere. And I do think that today, bringing this community together as we're doing is really, to me, that feels like a strong start. At Girls Inc., we've leaned into the expertise from the fields of public health and mental health. We've combined it with our own expertise in positive youth development. And what we're doing is trying to create resources for all caring adults to support the young people in their lives who have been impacted by trauma. In addition to trauma responsive staff training, we provide a Mind Plus Body program for the young people that addresses a broad range of challenges for girls: physical, mental, social, and emotional health. We also have resources for family and community members that are freely available on our website, girlsinc.org. We have a great partnership with an organization called Learn to Live. We are, through them, able to offer our staff and all of our teen girls access to a free cognitive behavioral therapy-based app, and that's called Learn to Live. Again, these are some of the things that we've been able to do, but again, it takes all of us to work together. It has to be that we each provide what we know in our part of the conversation, and that we trust each other and join forces, really, rather than trying to go off competitively or suspiciously and do our own thing. This is, to me, the best answer really is to keep talking, to keep acknowledging where we feel we have gaps, and to keep working together.
I love that. Thank you, Dr. Hull, especially for mentioning teachers at the beginning of your discussion, right? There's PTA, Parent Teacher Association, because it's important for us to work together, and for also talking about being inclusive, right? We have to think about it totally different. Thank you. Dr. Jones, the CDC recently released data from the Youth Risk Behavior Survey that provides an important snapshot of adolescent health and well-being. Can you give us an overview of the findings from that data and the trends of students' experiences with trauma and harm?
Yeah, so I think for me, the big takeaway from the most recent YRBS release, which came out a couple of months ago, and then some more detailed analyses from CDC researchers came out more recently. But the big takeaway is that kids are struggling in our country. I don't think this is news to any of us, certainly not news to the audience. But to put a finer point on it and some statistics behind it, which I hope serve as a call to action for all of us, we found that 42%, that's 42% of high school students reported feeling persistently sad or hopeless in the past year. 29% reported experiencing poor mental health. 1 in 5 seriously considered suicide, and 1 in 10 attempted suicide in the past year. As I mentioned, at CDC, we really think about how these mental health challenges are also connected to exposures to violence and other traumatic events. So YRBS also asked questions about exposure to different types of violence. So same survey, same year, 20% of students said they witnessed community violence. 16% said they were cyberbullied. 15% were bullied in real life or bullied at school. And slightly more than 1 in 10 reported that they experienced sexual violence. We also asked questions about feeling safe. So almost 1 in 10 students said they didn't go to school because of safety concerns. And 3.5%, while that seems like a small number relative to some of the other statistics I've shared, it's a large number given that 3.5% of students reported carrying a gun in the past year. This is 9th through 12th grade students. And those are the top line numbers overall. But when you dig into it by gender, by race, ethnicity, by LGBT status, we see that the rates for these outcomes are generally higher among females, LGBT students, as well as many racial ethnic minority groups. And then when you look at combinations of those groups, it certainly is even greater. So again, like ACEs overall, as I mentioned, it's not evenly distributed. People are being impacted in differential ways. And so, it's important as we think about who is being impacted, how are we harnessing, as Stephanie just mentioned, culturally competent approaches that resonate with people and communities. I think the other important thing to note is that the trends that we've seen, in particular the mental health trends, have been growing for more than a decade in this survey. Oftentimes, it's sort of people want to pin it on COVID. And while certainly COVID exacerbated this, it was a huge disruption to society, lack of connectedness. a lot of uncertainty, economic stressors, family stressors. It did not start this. We have been seeing the mental health challenges among young people growing for more than a decade and continue to increase throughout the COVID-19 pandemic. I think it's also important to note that all these topics are connected, that exposure to trauma is strongly linked to increased risk for mental health challenges, suicide, substance use. And we recently, with the YRBS data, did an analysis that really tried to understand the connections between exposure to community violence, gun carrying, substance use, and suicide. And what we found is that among those 20% of kids who experience witnessing community violence, that community violence was consistently associated with increased odds for carrying a gun, increased odds for engaging in substance use, as well as suicide risk. I think this really underscores not only do we need to come at this from a data-driven, culturally competent approach, but also we have to think about this in a holistic way, that these are not individual challenges, but that they are collective challenges that communities are facing. And so we have to think about what are the root drivers here? What are the shared risk and protective factors? And really think about, from a response perspective, who are all the people in the community that need to be together, coming together to address this? And I think for me, that's the beauty of the PTA in particular, is that you can be that bridge and conduit between community and family and school, and help to be that convener in communities to say, this is not on schools to solve this problem, but it's not also, on families to solve this problem, but as communities, we need to come together to solve it.
Thank you, Dr. Jones. You're right. It takes a village. Dr. Greene, what are some promising practices for screening and assessing children who have experienced or have been exposed to trauma? And which effective intervention methods can parents, caregivers, and schools adopt to best help children and youth in these needs of services?
Once again, I'm biased, but I want to speak a little bit to what Dr. Jones was just talking about. All of those things that Dr. Jones just described should cause us to ask, what is it about the expectations we are currently placing on our kids? What is it about the environments in which they are in that is causing kids to present as being so mentally unhealthy, and to exhibit so many concerning behaviors that tell us that they are struggling? I think we need to take a very close look at that. If I was to pick one arena, and this is not fair, but I'm going to pick schools. There are some very interesting things that have come down the pike in the last 20 to 30 years that there are actually data to tell us made things worse for kids. High stakes testing among them. When you transform teachers into test prep robots, you end up having teachers telling you that a lot of the humanity has been taken out of the job. And a lot of them leave the profession, which is what we're seeing right now. Educators don't get into education to be test prep robots. They get into education to be human beings and to educate kids. We've got to put a lot of that back in the job. Zero tolerance policies. A more muscular approach to a problem, always tempting, really easy to do, usually counterproductive. And we see schools now, right on the heels of COVID, school systems in many states talking about the need to be more muscular in how they're dealing with kids who are clearly struggling. More muscular never gets the job done, and yet it's so seductive. To your question, there are many, which I suppose I should answer, there are many instruments that we could use to identify a child's adverse childhood experiences. There are instruments that we could use to try to figure out what psychiatric diagnosis a kid meets criteria for. I'm not a very diagnostic mental health professional. In the collaborative and proactive solutions model, we rely on a pretty straightforward instrument called the assessment of lagging skills and unsolved problems. It gives us what we call the information that's been missing. What are this kid's lagging skills? What are the expectations this kid is having difficulty meeting? that are causing them to respond to frustration in such a maladaptive fashion. So the skills we're often talking about, and let there be no doubt, a trauma history can compromise a human being's skills in these areas, include flexibility, adaptability, frustration tolerance, problem solving, emotion regulation. That's what I want to know about. I may not be able to establish cause with great precision, but I want to know what I'm dealing with here in terms of what skills are compromised in a kid, irrespective of how they came by those compromised skills. That helps adults get the right lenses on. But what I especially want to know is what expectations this kid is having difficulty meeting. Coming to school on time, completing a particular academic task. The list is infinite. I'm not going to be infinite here. Those are the expectations that are causing concerning behaviors in kids. And they are expectations that a more muscular approach will never help a kid come close to meeting, because punishments don't do that. Detentions don't do that. Expulsions don't do that. And as we now know, stickers don't do that. Planned ignoring doesn't do that. So I think we have to be very mindful of what is going on in the lives of our kids. And in the case of schools, is what we are providing them, especially in the form of our school discipline program, really going to address what's really going on with our kids. And in the CPS model, that begins with a very simple instrument called the assessment of lagging skills and unsolved problems. And just in case you think that that's proprietary, it's free on the Lives in the Balance website.
Wow, thank you. What I heard you say was get to the root. Thank you for sharing that, Dr. Greene. Okay, Abigail, the stress of school shootings has caused overwhelming trauma for children and families, as well as educators and administrators. What are the short-term and long-term physical and mental health consequences of exposure to gun violence?
So when we take a closer look at that reality I mentioned earlier, that gun violence is the leading cause of death in the US for children and teens, it's also really important to acknowledge that children and teens of color are disproportionately impacted by this crisis. And we've heard some of that already on this panel. So we know that Black children and teens are 17 times more likely than white children and teens of the same age to die by gun homicide. We know that Latinx children and teens are 2.7 times more likely than white children and teens of the same age to die by gun homicide. And when children and families are seeking healing and support after incidents of gun violence, it's critical that they have access to culturally responsive and trauma-informed services across systems. And I really appreciate what Dr. Hull was saying earlier about putting our own oxygen mask on before we help others. Because when I am speaking to educators and administrators about the trauma of gun violence, what's been fascinating to see is that what brings them into the room or the conversation is a concern about how trauma is affecting children and their learning environment. And what always happens is the conversation turns into something bigger, and that's about how trauma is affecting educators and administrators and how they feel ill-equipped to process their own trauma. So we oftentimes equip educators on how to de-escalate students in learning environments and respond to students who are activated. But how can we better support our educators and the workforce to respond to their own trauma? Because that is a reality of what we are facing right now in our country. And how can we support them to regulate their own responses to trauma and fear? Because the workforce is hurting, and the workforce is traumatized, and we must do more to sustain them. And I think it's its own tragedy in our country that we are losing skilled and committed teachers and educators to the threat of gun violence, whether or not they are being personally affected by gun violence in their classrooms or in their community. So, but I think it's critical that we acknowledge that although it's devastating, school shootings are a very small percentage of gun deaths in our country. And the horrifying truth is that far more students experience gun violence at home or in their communities than at school. And this gun violence, as we've heard already today, impacts students' ability to concentrate, their ability to learn, and their ability to succeed in the classroom. So to build safe and positive school environments where students can thrive, we need to address gun violence wherever it is affecting students. And that's not just within school walls. Because the reality is, heartbreakingly, every day, 120 Americans are shot and killed, and 200 more are shot and wounded, and countless others are witnessing acts of gun violence. We know that each day, a new family and a new community is grieving the death of a loved one. We know that each day, survivors who've been wounded with a gun begin the long road of living with the physical and the psychological scars of gun violence and the trauma from gun violence. And that's why each day I feel the urgency to take action to end gun violence that is creating these short-term and long-term effects that are shaping the lives of so many Americans.
Absolutely. Addressing school violence. You said it best. Thank you, Ms. Abby. Okay, so Dr. Hull, we know that equity remains an issue, and as it relates to getting children and families the support that they need to address the impact of traumatic experiences, especially for girls and communities of color. How do we elevate the voices and concerns of girls of color and work to build their resilience as they navigate tough issues?
I think we all agree that every girl should have an equal opportunity to succeed. And we know that girls are facing discrimination because the intersection of race and gender often will affect their academic achievement, but also their self-esteem and their overall well-being. And we've just heard all the other panelists second this. Unfair school discipline policies and practices are disproportionately harming girls of color, girls with disabilities, LGBTQ youth. People are being pushed out of school when school should really be part of the solution, not the origin of the problem. So, again, I just will second everything my colleagues are saying about harm reduction being at the core of this. We need to insist on policies that will ensure that kids have access to equitable schooling. That needs to include greater safety at school, greater freedom from fear at school. They shouldn't be trying to take matters into their own hands. They shouldn't feel that there are matters to take into their own hands. It's really important to encourage non-punitive approaches to school discipline. We need to engage families and communities, but also students in the policy development that really governs their safety at school. I think we just need to invest more in school and community mental health services in order to create these safe spaces. It's in schools where most kids have the most access to mental health resources. So in that case, I think something good is happening. And I'll say and, not but, adults who don't feel supported and prepared can't help kids effectively. And I just can't say enough that our young people will tell us what they need if we listen. They'll tell us on a survey if we don't listen to their words. They'll tell us with their behaviors or symptoms or diagnoses if we don't listen to the surveys and the words, but they tell us what they need. And we know at Girls Inc., for example, everything we do centers around the voices of girls. We let girls lead us. They advocate with us. We provide them access to platforms when people only want adults. We get up on the platform and hand the microphone to a girl so that the girls can speak freely about the things that affect their lives. Just as an example, one of our participants in Girls Inc. of San Antonio actually advocated to the teachers' unions to get youth representation on the school boards. And now she's working to create safe and inclusive mental health spaces that incorporate the sensory needs of students in her school. And parents too need to get involved in this in different ways. We are engaging them, and our organization works with them because they're the primary caregivers of the young people that we serve. We should be providing more targeted resources to them to help them navigate all kinds of difficult conversations with their children and with their schools. I think that they'd be on the side of their children with schools. And I do genuinely believe that schools want to be, along with all the other agencies, supportive of young people. There's a lot of information that we've heard today that shouldn't be a surprise to anyone at this point, but we haven't threaded all of it together and brought kids into the dialogue and created something that is a viable and resilient solution to this problem. And it feels like we've had many conversations without ever having the resolve to just try, two of the things that each of the panelists has said and solve this problem.
Wow, thank you. Who would have thought? Empowering and engaging our youth and listening to their voices. They are the future and they are definitely creating change. And I love hearing about that young lady speaking to Teachers Union. That's amazing. Okay, so we have one more question for each of you, and we'll start back with you, Dr. Jones. As we begin to consider a community-based approach to trauma-responsive care, can you help us understand how the experiences of trauma-exposed children differ from the experience of children who have not been exposed to trauma? This is two questions in one. The second one, how can we design a system of care that works for children and youth who are both directly and indirectly exposed to trauma?
Thanks for the question. I think some of our other speakers, including Dr. Hull, just in her last comments, talked about some aspects of how we might think about a community-based approach and thinking about systems that need to change in order to support and produce a supportive environment. I think it's important to recognize that there is a spectrum here. Somebody who has experienced repeated sexual violence, how they may respond to different stressors is going to be very different than somebody who might be experiencing some other type of trauma. And so I think it's just creating that flexibility and recognition that there may be a variety of trauma-informed ways that people need supports. But I also think it's important that we look at it more holistically and not focus on sort of a one versus the other, trauma-exposed kids versus non, recognizing that there is a lot of potential public health gain by focusing on healthy relationship development, life skills, problem solving, conflict resolution, whether you've been exposed to trauma or not. In some cases, that might reduce perpetration that could be re-traumatizing to other people who have experienced trauma. So I think we have to look at it in a holistic way, that there is a universal approach to this, and thinking about how are we just creating a healthy environment for kids to be in, whether that's in the school or in the community. And then what are those steps that we're taking to also create space for kids who may have challenges and they may have outbursts, frustration, concentration problems, challenges with resolving conflicts, and recognizing that these are not bad kids. These are likely kids who have experienced some adversity, and there are different ways to handle them than, as others have talked about, disciplinary practices that potentially set them back even further. There are certainly trauma-informed treatments like multisystemic therapy, trauma-focused cognitive behavioral therapy that could be provided in school health settings for people who have experienced trauma and helping them to work through that. But I think there is a broader opportunity to think about how we're creating school connectedness. How are we looking at policies in schools to create safe and supportive environments so that kids feel like they belong, there's an inclusive environment, and that there are resources for those who need those resources, but taking that broader view of how are we creating a better environment for everyone, so that all people can be healthy and thriving. I think the other part is that, again, we need to do those things in schools, but we also need to connect it to the community piece as well. And certainly everyone has a role to play here. And part of our resources that we put out for ACEs prevention is thinking about how do we also create those opportunities for engagement with caring adults and activities. So some of this could be after school programs or mentorship programs, but some of that could be in the community, YMCA, Boys and Girls Club, other opportunities for kids to get, as Dr. Hull was talking about, sort of that leadership experience, stepping in and providing that feedback, and getting those opportunities to be empowered and demonstrate those leadership skills. We know that those, in particular among girls, can have very important protective effects in reducing risk factors and promoting positive effects. But also thinking about how are we working with parents to strengthen the parent-child relationship. I have a 10-year-old. We're getting ready to get into the fun years, and I'll say fun in quotation marks. And, I hope that we've done the right thing so far to set her up for success, but I no doubt can always use support in how do we navigate setting boundaries, exploration that's just going to be a natural part of development, but doing it in a healthy way. How do we navigate social media when the time comes for her to want to engage in social media? So thinking about what are those programs that could either be school-based or community-based that can help strengthen that parent-child relationship at an age-appropriate levels throughout childhood and adolescence. That's another core part. And then I think just more generally, having conversations like this, raising awareness that ACEs exists, that trauma exists, that this is not happening somewhere else, but that it is happening in your community, and that there are things that we can do to change that dynamic, to promote help seeking, to promote conversations, to promote prevention. And that is where I think everybody should be able to see themselves as a being part of that conversation and a part of the solution.
Absolutely. Thank you for saying that this exists. It's there. And have fun with your baby, with the 10-year-old experiencing that. I can tell you that you will have a lot of smiles. Dr. Greene, you spent more than 30 years helping parents, caregivers, and educators learn how to effectively navigate the challenges children and youth may encounter as a direct result of traumatic and adverse childhood experiences. What steps can we take to create a collaborative partnership between adults and children with the intention to positively engage impacted youth in solving the problems that affect their lives?
Anna, thank you for teeing it up for me, because the answer, to keep it simple, is 3 steps. They're the 3 steps that are involved in solving a problem collaboratively and proactively. That's why the model is called Collaborative and Proactive Solutions. What we've done here, and Dr. Hull, you're going to love this, is operationalize, systematize what it means to give kids voice, to listen to kids. And you know, if we don't formalize that, sometimes people aren't exactly sure how to go about doing it. Bottom line is, there are 3 steps to doing what we in the CPS model call Plan B. This is where you're collaborating with a kid to solve a problem that could be causing their concerning behavior. The first step, I love the name of it, is called the empathy step. This is where we are gathering information from the kid so as to understand what's making it hard for them to meet a particular expectation. One of the key themes of the CPS model is listen to the kid. And that is exactly what Dr. Hull was just saying. The problem, of course, is that many caregivers aren't exactly sure how to do that. Many caregivers are very caught up in the solutions that they want to impose. Many caregivers, and some of them are trained this way, are very caught up in thinking they already know what's getting in the kid's way, so they really don't see the point in listening. Listening is the purest form of empathy. And I'm always telling caregivers when they're in the empathy step, be prepared for jaw-dropping moments as you discover that what you thought was getting in the kid's way is not what's getting in the kid's way. That doesn't happen if we don't listen, and it doesn't happen if we need to teach adults how to gather that information from kids. What Abby was telling us is that a lot of adults are being trained on how to de-escalate, restrain, seclude. Those are crisis management strategies. I'm talking about preventing crises. And another key theme of the model is get out in front of it so you don't find yourself in the heat of the moment. The second step, real quickly, is called the Define Adult Concern step. This is where the adult is entering their concerns into consideration. Why do they think it's important for the kid to meet the expectation? And here's what I find. When kids feel that they're concerned, this is human nature, by the way. When kids know that their concerns have been heard, they are far more likely to be willing to listen to ours. And yes, Dr. Jones, you can use this with your 10-year-old. If you haven't been, you could have been using it for the last 7 or 8 years. The third step is called the invitation. This is where kid and caregiver, if this is kid-caregiver problem solving, it could be kid-kid problem solving, are collaborating on a solution. But a solution that must meet 2 criteria. This is where we human beings frequently go wrong. The solution has to be realistic. Both parties got to be able to do what they're agreeing to do. And the solution has to be mutually satisfactory, meaning the solution truly addresses the concerns of both parties. Here's what I've been saying a lot lately, and world history, including current world history, bears me out on it, as well as my work with thousands of kids with concerning behaviors. If a solution is not realistic and mutually satisfactory, I promise you, this problem is still unsolved.
Wow. Thank you, Dr. Greene, for sharing those 3 steps. I love and I'm just going to keep saying this. I love the fact that you guys keep saying, listen to our children. That's important, and that is key. And what stood out the most to me was that you said be proactive in the work that we're doing and work collaboratively together, parents and their children. So thank you for sharing that. Abigail, the trauma of gun violence is immeasurable. Everytown recently released a first of its kind report, Beyond Measure, Gun Violence Trauma. What have you learned from survivors of gun violence?
Thanks, Anna. So as you mentioned, Everytown for Gun Safety recently conducted a qualitative focus group study to better understand those short-term and long-term impacts of trauma from gun violence, and also ways to better support survivors of gun violence. So what we found was that the ripple effects and the reverberations of trauma from gun violence are profound and beyond measure. That's actually why we titled the report Beyond Measure. For example, we learned from our study, and something I've seen over the years in working with survivors of gun violence, that trauma from gun violence can reverberate across geography and beyond neighborhoods to affect the behaviors and the actions of a person who has a shared identity with the incident of gun violence. So this was especially relevant in incidents of hate-based violence. So we recently marked 7 years since the tragedy at the Pulse nightclub shooting in Orlando, Florida. Our findings show that LGBTQ+ people across the country and beyond the community of Orlando, Florida, their behaviors and their actions were affected by witnessing this horrific act of gun violence. And that is because of the shared identity that they had with the community targeted. This bears out across other hate-based crimes. We see over and over again that people aren't just deeply saddened to learn about these horrific shootings and these incidents of gun violence, but their behaviors and their actions are being changed as a result. The other element that I want to talk about briefly is post-traumatic growth. I feel like throughout my career, I've received a masterclass from survivors of gun violence on what post-traumatic growth can look like. And it's really this concept that some individuals experience a positive growth of some kind following their struggles with trauma. And this type of growth can be measured by new possibilities in one's life. It can be measured by improved relationships, a greater sense of personal strength and spiritual development, and even a greater appreciation for life. And so in our study, nearly half of the focus group participants spoke to experiencing post-traumatic growth of some kind. But it's also important to note that there are some people who rejected the concept, and post-traumatic growth was not part of what they experienced. So what we saw was that in addition to a person's innate resilience, and trauma-informed and culturally responsive programs are so critical to support people after trauma. Access to mental health services was key for survivors in order to process their trauma, as all of us know on this panel, and support them on their journey towards healing and potentially on their journey towards post-traumatic growth. And in particular, access to those culturally responsive programs was critical so that as a person is navigating the many, many systems that they must interact with after gun violence, we know that we must do better to ensure that people are not being further harmed by racism, by homophobia, xenophobia, bias, ignorance, and intolerance. So I'll end with this. Gun violence it impacts all of us in different ways. And ending gun violence, it will take all of us. And something we can all do to honor survivors and prevent more trauma from gun violence is to work to stop gun violence from happening in the first place. So connect with parents and community leaders to create safe and trusting spaces, as we've heard what the significance of that throughout this panel again and again. Those trusting spaces should be free of stigma and fear in your schools and your homes. Normalizing conversations about gun safety and the importance of responsible gun ownership through secure storage. You can check out our Be Smart program if you're interested in step-by-step prompts to securely store your firearms and have those conversations with other parents and caregivers. We need to challenge ourselves to do our own work to be culturally and trauma responsive, to foster those environments for post-traumatic growth and healing for survivors. Because we know that when advocates and partners on every level are coming together and raising their voices in unison, the gun violence prevention movement only grows more powerful.
Thank you, Abby. And thank you for sharing this information. It's so important to know that gun violence does not go away, but does have a lasting effect on survivors, and for sharing those golden nuggets at the end. I truly appreciate that. Thank you so much. Dr. Hull, you're the last one with the last question. What role do cultural factors play on how different communities perceive and respond to child trauma, and how can we ensure that all children receive the support that they need?
Well, I think we've just heard in many different ways that no one is immune to this kind of work. And we know that communities may experience even more trauma due to racial or systemic or other, pervasive inequities that really contribute stressors and traumas to their experiences. For example, we know that Black families or immigrant families are more likely to live in disinvested neighborhoods. They will probably have more under-resourced schools that don't even have counseling and those kinds of things available. We know that children living in poverty are more likely to be exposed to things like lead poisoning and poor nutrition, which can lead to educational difficulties, learning difficulties in those kids. And then, of course, they present with behaviors that lead them to be disciplined in different ways that cause their experience just to be terrible in school. So I think what we really are saying is that there needs to be greater awareness of the intersectional issues and all of the different ways that kids are navigating adverse experiences. But I liked also hearing that, we need to think about this as a growth-based approach, a strength-based approach, and definitely a community-supported approach. For example, at Girls Inc., we are encouraging girls to be leaders. You've heard me say that we want girls to lead in their own lives. When they know that they have this power and they learn to use this power, it really does promote emotional and even physical well-being for them. And we offer them all kinds of life skills, learning about self-care, learning about talking to people about difficult topics, learning about financial literacy. All those different things are research-based programs that are proven to help girls succeed. But it's not just becoming healthy, independent adults. It's really, we can equip girls to just change their family story, to create new paths for themselves toward wellness. And when they succeed, their communities succeed, their families succeed. And, then the leadership of the schools changes. And the whole thing is a systemic approach to change that's really positive. What we see, we are mostly focused on life skills, but we see that the girls in Girls Inc. can surpass the national average in academic performance. They're also having a better, chance with school-related behaviors. They are more likely to do physical activity that's healthy. They are more likely to see leadership outcomes. And it's because of that combination of adult mentors, safe spaces, and life skills programming. So what we're saying is that youth-based organizations like Girls Inc. and others can be a partner in these spaces. We know that schools can sometimes lack capacity. That is not a criticism on our part. We are here and we welcome the opportunity to collaborate with you. And I know all the other leaders of youth organizations at this point, that I know that we all feel this way. We want to have you partner with us. We would encourage volunteers. We'd like you to encourage your students and your families to join one of the affiliates of one of these programs. We certainly want to ensure right now that girls have more access to these programs. We're very concerned about what we're learning about what's happening for girls. But I want to say that I'm really reassured by this conversation. I'm looking forward to creating more collaborative spaces. I'm looking forward to building on some of these partnerships. These seem like the promising practices right now. And, I really am heartened by the idea that we are all here to talk about how we could work together. I think you can hear that we agree and we are ready to hold hands and get this thing done. And it's been great to be part of that conversation. So thank you.
Thank you, Dr. Hull. Wow, what a wonderful conversation, right? This amazing information just empowers us to grow. And I want to thank you, Dr. Jones, Dr. Greene, Abigail, and Dr. Hull for sharing your perspectives, your insight, and most importantly, your passion. It came out through each of your comments throughout this conversation. And I just want to say thank you. We want to thank you for your commitment to this critical work. And you're right, Dr. Hull. It takes all of us to get this work done together as a team. So thank you, everyone. We hope everyone watching has a renewed sense of empowerment to do all you can to champion trauma-responsive school and community environments. Our children and youth need stable and safe environments that help build resilience, especially when they are healing from the impact of violence and traumatic experiences. They need us to get this work done. Before we go, we have some words of inspiration to share from our 2022 Congressional Voice of Children's honoree and good friend to PTA, Senator Cory Booker of New Jersey.
Thank you for gathering here. I want to say a warm welcome to the national, state, and local leaders of the PTA. I am thrilled that for 125 years, the PTA has stood on the front lines of doing the work to cultivate really the greatest natural resource we have as a nation, the genius of our children. You celebrate a rich history today, and you celebrate the difference you all have made, not just in the well-being and happiness of so many of our nation's young people, but ultimately in helping to build the strength and the soul of our nation and who we are. You cannot have a great democracy without a great system of public education. And so thank you for your efforts. And I'm also proud to join with you in common cause. Because look, my entire career, I've leaned on the PTAs in the communities in which I've worked as a city council person, as mayor, and even now in the state of New Jersey as the senator, one of the two senators for our state. And now we know that all the evidence is clear. Investing in quality early childhood education is critical for children's long-term success. We need to work together on the issues that we still need more success on. Of course, early childhood education is one of them. And also another is the mental health issues that we see on a rise with our children. We need to take action to address the mental health crisis. We need to increase funding for mental health in our schools. We need to make sure we're there for early childhood education and make sure we're there for the safety and security of our children. Families, caregivers, and community leaders, we all are needed. It's not been said too much. It really does take a village to raise a child. And so I'm going to tell you, I know we have tall orders before us. Family leave policies, affordable child care, safe and secure schools, making sure our children have access to mental health. These are tall orders, but we are up to the challenge. The 125-year history of the PTA speaks to the power you all have shown in shaping the destiny of not just generations of children, but the destiny of this nation. You have taken on challenges and overcome them, and now we've got to continue it. I've introduced a lot of legislation that I know we're in partnership on, and I'm proud, especially of the work we're doing to really address the holistic needs of students in classrooms. I'm going to continue to work hard on the federal level as one United States Senator, but that power is magnified and multiplied when we all continue to work together. So, 125 years. You all know the African saying. If you want to go fast, go alone. If you want to go far, go together. You all have come a mighty long way, and we still have more to do and more miles to traverse on this journey. Thank you for focusing on our children and the families that support them. Thank you for being the bedrock of our democracy. Thank you for making me and so many others know that the future of America, as great as our past has been, the future is going to be even better. All the best.
Wasn't that awesome? I love the moments like this where we discuss real solutions to the issues facing our children and youth, which supports our families and PTAs. It's another reminder that when you join PTA, you are truly never alone in trying to change things for the better. Thank you once again to all of our panelists and guests who helped us understand how we can address these important topics in our communities. Please check out their website and collect the information.